Hey everyone, I want to talk to you today about vitamin IVs. What are they? Are they safe? And do they work? And by the way, my name is Dr. Michael Corsilis. I'm a naturopathic doctor and a physician assistant. I practice functional medicine or integrative medicine where I kind of balance the best of both worlds, conventional medicine and natural and integrative medicine. So when it comes to vitamin IV infusions, these have been around for a long time, but there's more and more practices that are doing it, and we offer it at our practice as well. So I want to give you just a little bit about this. I don't know if you ever gone to the ER and gotten a saline bag of fluids or even got a banana bag. I don't know if you ever heard of that, but the bag looks a little bit yellow. There's some B vitamins in there, some magnesium, and basically like a general multivitamin in that IV form. So a lot of people will get that like if they're super dehydrated or they are on a big bender over the weekend, drank too much and got dehydrated from that. So vitamin IVs, this concept has been around a long time. But the reason why I like to recommend it is because it's in IV form or intravenous form. So it's vitamins or nutrients in saline that you're getting directly into the bloodstream, meaning it's 100% absorbed. Now, when it comes to the IVs we offer here, there are IV drips. So you got the IV bag and it's slowly dripping over you over anywhere from 20 minutes, 30 minutes, to even an hour if it's a really slow drip, depending on what's in the IV bag. There's also IV in push form. So you get a big old syringe with those vitamins and you push it directly into the vein. And so that version is much quicker, but it's not as effective in my opinion compared to the IV drip. But part of the reason I like it is because, again, it is 100% absorbed, because I have a lot of people saying, well, I'm on vitamins, I'm on vitamin C, or I'm on iron, but they come to me, they're super tired. And so they're not absorbing a lot of those things. Now, when it comes to what IVs are good for, probably the biggest reason why people get vitamin IV infusions or pushes is for fatigue. Fatigue is super, super common. So we always want to try to find out what's the underlying cause to fatigue. We can definitely give you some IVs, but we for sure got to find out what are the things that are contributing to fatigue. Is it straight up burnout? Is it poor sleep? Is it just poor diet? Is your thyroid off? Or are you anemic? So we got to find out what's causing the fatigue. And usually that's done with blood work, examination, history, and all that. Once we find out and rule out big red flags, and if we find out that it's truly indicated, vitamin IVs are indicated, yeah, we can get some vitamin IV going. So what to expect when you get in a vitamin IV infusion? We basically find a vein, connect you, take the needle out, and you got a little plastic catheter connected to the vitamin IV bag, and you're just chilling there with that IV. And that can, depending on your vein, on how hydrated you already are, it can be like a drip that can be 20 minutes, 30 minutes, again, sometimes up to an hour. It depends on what's really in it. So I mentioned fatigue is a big common reason why people do it. Another reason why people do vitamin IV infusions is for dehydration, which can cause fatigue, but also just to boost the immune system. So some folks are actually a little bit run down, catching colds often, or they really want to optimize the health and immune system, and so they'll do high-dose antioxidants. So vitamin C is a great antioxidant. And when it comes to antioxidants, we're losing antioxidants all the time. So if you have a lot of pollution, whether that's out in the environment or in your foods, you're putting that junk in your system. Your body uses up all these antioxidants to deal with all those toxins. Just detoxing in the body and just everyday processes of running our body is totally using up our antioxidants, so we always have to keep replenishing it. So that's why IV infusions is really helpful for that. So to get those antioxidants up, which have been shown to help for the immune system. And high-dose vitamin C has actually been shown to fight off certain infections as well in high-dose form. So when it comes to what's in the IVs, so we offer patients like vitamin C IV drips, which is a common one. A lot of places will offer that. So you can get high-dose vitamin C, but it's not always indicated in everyone. Certain conditions you don't want to do high-dose vitamin C. So definitely talk with your healthcare provider on what kind of precautions you need to rule out before you do a vitamin IV. Some folks will do vitamin IVs for headaches. You have an acute migraine or you've got chronic migraines, you can do magnesium on a daily basis. And high-dose riboflavin as well on a daily basis to prevent migraines, but you actually can do magnesium to treat a migraine. So some folks will come in for an IV of magnesium to help with that. Magnesium also has a lot of other benefits. It can help loosen up the stool for if you got constipation issues. It can help with sleep, it can relaxes you, it helps for muscle spasms as well. but for sure magnesium, because there's a lot of times the vasospasm will contribute to migraines. Other folks will just like, man, I really want to optimize my health, and they'll add glutathione, which is like the master antioxidant, with vitamin C and some B vitamins. Other folks are like just have adrenal fatigue or adrenal burnout, and their mitochondria, or the powerhouses of the cell, need those antioxidants fuel to really heal up those adrenal glands and to heal up all the mitochondria to give us energy, because that mitochondria is busy making ATP, but most often people are really needing those nutrients to feed that mitochondria to give you that energy. So IV infusions are probably the quickest way to get those get your symptoms better. Now the one thing is, a lot of folks will ask me, does it really work? I tell people you typically need a series of vitamin IV infusions. Everyone's different. We try to individualize treatment. A good example is think of people going to a chiropractor or a physical therapist. You don't just do one treatment, you do a number of treatments, right? Whether that's 6, 12, or what have you. So same deal with IV infusions. You need a series of IVs. After those, some people just do it as needed. They're like, I'm about to go on a plane ride. I'm going to go get a vitamin IV and get juiced up and boost my immune system and get me hydrated. So some people will do it as needed, but initially I usually recommend a series of vitamin IV infusions. Try those series of infusions, take a break, and then see how you do. Most people notice when they do take that break, they're like, man, I'm really, really run down since I've taken a break from my vitamin IV infusions. Other folks, it could be other indications. So some folks who have really low iron will do iron IV infusions, whether we're treating anemia or just straight up low iron. For whatever reason, again, you got to find out why you have that low iron. Are you not absorbing the iron in your diet? Do you have a low diet in iron? Or are you just having really heavy periods, for example, and you're losing iron that way? So you got to find, again, the underlying cause. But we have some patients do iron IV infusions. They'll do a series, and then we'll repeat labs, and often I'll see iron levels start going up because it's just way better absorbed. We also offer patients doing full spectrum vitamin testing as well. What's your overall vitamin status? What are the vitamin levels? What are your overall antioxidant status? Are you depleted in any of those nutrients? And do we need to put that in the IV bag? We can't put every single vitamin in there. A good example is like fat-soluble vitamins like vitamin A, D, E, and K. You can't mix that with the water-soluble vitamins like vitamin C and B vitamins, etc. Fat and water don't mix up, right? So certain indications, and everyone's a little bit different. But that's kind of the thing I recommend, is doing a series, see how you feel, look at your symptomatic relief, and also look at objective data. What are some blood work and lab work that you need to repeat, see if there's improvement. So there's other conditions that people do. So we talk about fatigue, boosting the immune system, boosting vitality, even optimizing health. Chronic pain is a common one too. So again, with chronic pain, your mitochondria are really depleted, which rely a lot on those antioxidants and vitamins. So those are just some of the reasons why people get these. There's a number of reasons, but fatigue, immune system, pain, those are common ones I usually recommend. So hope this helps. This was just like tip of the iceberg kind of things. There's a lot more information, but if you do have questions, please put a comment below. I hope you enjoyed this video. Thanks for watching, and I will talk to you guys later.